What is a nonunion, and how do I know if I had one? Well, first of all, you need to know what a nonunion is. And that means your doctor has probably performed a fusion of one of your discs. So he's taken out your disc, he's fused the two vertebrae together, and they no longer move. Now, normally in the neck or low back, that pain should be resolved when the bone heals. And that bone should be healed by 3 months. Give it 12 weeks. If you're still hurting and having a fair amount of back pain after 3 months, or if it continues gradually worsening, and if your doctor has only taken an x-ray, I personally feel you need a CAT scan, because x-rays can miss a nonunion, which means the bone never healed together. And that we need to know, because if it hasn't healed together, we've got to take action and take care of you and get you better.